Hi, my name is Renee C., and I did the binge eating disorder portion of the DSM-5 condition presentation for the different types of eating disorders. The diagnostic criteria for binge eating has 5 classifications under the DSM-5 manual, starting with letter A. Under letter A in the DSM-5, it states that a binge eating episode is categorized by eating in private in any 2-hour period that is larger than the amount most people would eat given the same time frame. 2, sense of lack of control over eating. Under letter B, episodes are connected with 3 or more of these signs, symptoms, or behavioral manifestations. 1, eating more rapidly. 2, eating until feeling uncomfortably full. 3, eating large amounts of food when not feeling hungry. 4, eating alone because the individual feels embarrassed by how much they're eating. Number 5, when the individual feels disgusted with oneself, feeling guilty or depressed during or after eating. Under letter C, distress is present when binge eating. Under letter D, it occurs at least once a week for 3 months. Under letter E, it occurs independently from bulimia nervosa and anorexia nervosa. I would like to say here that the DSM-5 says that binge eating is not associated with the recurrent use of compensatory behavior that comes from bulimia and anorexia. There are several different levels when it comes to severity of binge eating. The lowest level is mild. This means that an individual will have 1 to 3 binge eating episodes per week. The next level will be moderate, and this is when an individual has 4 to 7 binge eating episodes per week. The next level is severe, and this is when a person will have 8 to 13 binge eating episodes per week. The highest level of severity is extreme, and this is when an individual has 14 or more binge eating episodes per week. I would also like to note here that the type of food an individual consumes in their binge eating episodes vary from person to person, and binge eating is categorized by an abnormality in the amount of food the individual is consuming and eating, and not by the person's craving for a specific type of food. The prevalence rates for binge eating are within 1 year. Prevalence rates of binge eating disorders in the U.S. citizen adults 18 or up is females having 1.6% and males having 0.8%. It is more prevalent in individuals seeking weight loss treatment compared to the general population, and it is more prevalent in adolescents and college-aged individuals. The ratio between genders are skewed compared to the other 2 forms of eating disorders. In addition, binge eating is as prevalent in females from groups of ethnic or minority groups as Caucasian females. This means that there is no disproportionality when it comes to the commonness of binge eating within females between different race groups and different minority groups. Binge eating development and course progression. Little is known about the development of binge eating disorder. What we do know is it occurs in children and is associated with increased body fat, weight gain, and an increase in psychological features. Loss of control of eating and binge eating might be an early stage or symptom of eating disorders for some people. 2, dieting follows the development of binge eating. This is different than bulimia because in bulimia, dysfunctional dieting comes before the onset of binge eating. This typically begins in adolescence or young adulthood, but can begin in later adulthood. 3, remission rates are higher in both natural and treatment courses for binge eating than for anorexia or bulimia. 4, binge eating is persistent. Similar to bulimia nervosa, binge eating has a similar course in terms of severity and duration. Crossover from binge eating disorder to any other eating disorders are uncommon. The risk and prognostic factors of binge eating are genetic and psychological. In binge eating, it appears to run in families, which could reflect additive genetic influences. There are some functional consequences of a person with binge eating. Social role adjustments, impaired health-related quality, impaired life satisfaction, an increase in medical morbidity and mortality, and increased risk of weight gain and obesity. Lastly, an associated increased healthcare utilization compared with body mass index. Match controlled subjects. Well, that is my portion of the different types of eating disorders for the condition presentation. I hope you learned a lot about the binge eating disorders and all of the other disorders in our presentation. Thanks.